Artificial Intelligence Doctor. User question. What patients rely heavily on atrial contribution to ventricular filling? Claude AI answer. Patients who rely heavily on atrial contribution to ventricular filling, atrial kick, include diastolic dysfunction / heart failure with preserved ejection fraction, HFpEF. These patients have stiff ventricles. Up to 40% of their ventricular filling depends on atrial contraction. Loss of atrial contribution can cause significant symptoms, often elderly patients with hypertension, diabetes, obesity, hypertrophic cardiomyopathy, HCM. Thickened ventricular walls reduce compliance. Atrial contribution can account for greater than 50% of filling. Loss of AV synchrony can dramatically worsen symptoms. Higher risk of decompensation without atrial kick. Restrictive cardiomyopathy. Stiff ventricles from infiltrative diseases. Heavily dependent on proper timing of atrial contraction. Examples include amyloidosis, sarcoidosis. High athletic performance. Elite athletes with physiologic LV hypertrophy need optimal filling for high cardiac output during exercise. Atrial contribution becomes more important at high heart rates. Pediatric patients. Smaller, less compliant ventricles. Higher resting heart rates. More dependent on optimal AV timing. Understanding these patient populations is crucial when considering pacing strategies, as they may experience significant clinical deterioration with loss of AV synchrony or poorly timed atrial contribution. Would you like me to elaborate on any of these patient groups or their specific pacing considerations?